Welcome to the Workology Podcast, a podcast for the disruptive workplace leader. Join host Jessica Miller-Merrill, founder of Workology.com, as she sits down and gets to the bottom of trends, tools, and case studies for the business leader, HR, and recruiting professional who is tired of the status quo. Now here's Jessica with this episode of Workology.
Welcome to the Workology Podcast, sponsored by Workology. With so many changes in the HSA, ACA, and new telehealth options, plus FSA, HSA, and EAP options, what a mouthful, employees are overwhelmed by making upcoming benefits and health insurance selections as new hires. You probably are too. These are all part of annual enrollment. HR leaders are tasked with helping employees understand and navigate these healthcare selections, and it's not an easy challenge. Today, I'm joined by Justin Holland. He's the CEO and co-founder of HealthJoy, the first benefits experience platform that combines an AI-powered virtual assistant with a team of online medical providers and healthcare concierges to deliver a simple, mobile experience that employees can turn to when they need care. Justin helped build HealthJoy to a $48.5 million in funding company and 220 employees in 3 countries. And its platform, HealthJoy, serves hundreds of thousands of members every single day. Justin, welcome to the Workology Podcast.
Thanks, Jessica. It's great to meet you.
You are an MIT grad and a serial entrepreneur with a background in launching successful startups. How did you evolve or come up with the idea of founding HealthJoy?
Yeah, I think as with most entrepreneurs, it's a very windy path. I think it started off at MIT. I was very fortunate to be able to take a lot of my coursework at Sloan, the business school there. And so my senior year, literally half of my courses were with the MBA students. And one of my final classes was a business, competition that effectively we gave pitches to a bunch of local venture capitalists. And I did very well. And from that, it was kind of like a pivotal push for me to say, hey, I don't have to be a management consultant or a banker. I could actually start my own company. And I started my first company right out of school. It was called Free Cause. And at the time, our initial focus was to enable people to help raise money for causes they were passionate about through their normal internet behavior. And that company ultimately evolved into a loyalty business and was acquired by Rakuten, the Japanese e-commerce company. But I learned a lot about disrupting user behavior, large-scale distributed technology, partnerships, selling through channels or working through a channel to get to an outcome, and of course the trials and tribulations of raising money. And the second company, I really focused on performance solely, and what I mean by performance is the focus of getting a consumer from point A to point B. So starting with their attention to getting to some outcome. Kind of like when you see an Instagram ad and you go through the purchase process for those shoes you like or whatever it is. And so we built a huge amount of technology before machine learning was a household word that was focused on ultra fast optimization of large scale data. And that company was open and sold and was later acquired by AVG. And that was basically 10 years into my journey as an entrepreneur. And I took a break and I actually tore my ligament in my knee, and I went through this journey of trying to not hit my deductible on my Obamacare plan, and was like, this is really, really hard. And I'm pretty good at Googling. So I was, it was kind of an eye-opening situation for me that wow, the technology really was not present in the healthcare space as much so as it was in e-commerce and other places on the internet. And so I kind of saw this massive opportunity to bring technology and really a performance mindset to this problem that I was personally going through. And as we dug into it and understand more about the employer-sponsored side of the challenge, that no matter how good the technology was, if you didn't have great partnerships with HR and consultants, that wasn't really going to go anywhere. And so it kind of was a good culmination of a lot of my past experience, coming into this, and obviously on top of a lot of naivete, with entering in healthcare. But it's been a wild ride and super fun so far.
What an awesome background. Let's talk a little bit about your company's role in supporting HR leaders and employees when it comes to benefits enrollment. How does that work?
Yeah, I mean, there's three really primary areas. First, we really centralize and digitize all the benefits for the employee. So, instead of a sheet of paper and 20 rows with 20 phone numbers and 20 websites, we give HR and employees one place to centralize all that communication. We know specifically right now in this pandemic environment that the centralization is key. HR leaders have to have a digital first strategy around benefits communication today. Second, really it's the 364 days they aren't enrolling. Benefit communication is a tedious process that we know many HR teams don't have the time to be able to do it the way they want. Our role is to be marketing those programs throughout the year and within the episodes of care that their employees are going through. So basically automating the communication at the right time in the right place. And then last, it's getting to the spouses. We know that many households, there's one primary healthcare decision maker. We know HR always has a very difficult time engaging with that spouse. And we tune really our entire performance funnel to ensure that we're getting their attention.
This is great because right now HR people are having those conversations and thinking about annual enrollment because it's not too far away.
That is correct.
Yeah, and they know that, so we don't have to remind them. But still, this sounds great. Being able to talk to the spouses or the partners, getting them the information that they need, because they always seem to have it about 15 minutes before the deadline. And HR is, we've already put in a full day's work and then some.
Correct. And then after 15 minutes after, they forget about it, right? And that's the challenge. You'll get that giant, booklet of paperwork that you get from that meeting, and either it gets stuck in the desk, never making it home, or even sometimes even forgotten in that meeting. So it's a consistent challenge.
When we kicked off the podcast, I mentioned all the changes that are happening right now, and the healthcare marketplace is changing rapidly too. Post-COVID, current COVID, it's continuing to evolve. And as HR professionals, we have to help our employees understand their options. Can you talk about how your technology, maybe in a little bit more detail, supports these efforts?
Yeah, I think, I say this internally, I say it to our partners that, this concept that 95% of people don't understand their benefits. And in 5 years, 95% of people aren't going to understand their benefits. And what I tell my team and where our technology is focused is it's our job to help people so they don't need to understand. Is to make it so simple that they don't even need to know. And the key is how do we lift up the important aspects of those benefits at the right time in the right place for the member. And we do that through our virtual assistant Joy. It's an AI-based assistant that's able to reach out to employees at the exact moment they are seeking care and offer assistance. And we also have a team that of concierge that are constantly curating recommendations and helping teach Joy what she needs to know to get the job done. And when Joy can't help directly, our concierge work directly with those employee members to give them whatever assistance they need. So, when I think about the way I describe our AI, it's really a human-assisted AI, which the realization that healthcare, I hate saying it, but healthcare is complex, right? You hear that 100 times a week, but the fact of that complexity to think that AI is going to 100% solve the problem is not reality. That you have to have that human element in order to get the outcomes you want for employees.
I love the name of your AI bot too. It's so great.
It went through a couple of iterations, and we had a moment our chief marketing officer was like, why don't we just call her Joy? And I was like, HealthJoy. Oh, yeah, that makes sense. So Joy actually came after we had already named the company. So you would have thought we would have been smarter at day one to give her that name, but it took a couple of years for us to get there.
Looking at the changing landscape of healthcare, what do you think is the most significant area that we as HR leaders should be paying attention to on behalf of our workforce?
And I think that I see where the focus is already where it needs to be, which is utilization, right? I think everyone on the HR side knows they're spending, $10,000 to $20,000, a year per employee putting together an incredible benefits package and sometimes with their benefit consultant or, with their internal team. And the majority of these plans have great cost containment strategies. They have great wellness strategies. They're trying to address the costs. So it's not a matter that, they're putting together everything they need to. And I think, the key point is you just got to make it easy. And the simpler it is, the employees will use it and they'll make the right decision ultimately if it's the easier thing to do. It's the path of least resistance. When we think about how we structure our technology, our interface, everything is about simplicity. If the reason you use Uber or Lyft, it's because within a couple of clicks you get what you need. And we believe that healthcare has been obfuscated to the point where it doesn't have to be as difficult as it is. And so our goal is to make it that simple. And when our team comes into work every day or right now when they log into their computer from in their pajamas, that's what they're focused on, is to make it super simple. And as ultimately that's our mission.
Let's take a reset. This is Jessica Miller Merrill, and you are listening to the Workology podcast, sponsored by Workology. We're talking about how we can do a better job at communicating health insurance benefits with Justin Holland of HealthJoy.
Are you tired of putting your professional development on the back burner? It's time for you to invest in yourself with Upskill HR by Workology. We're a membership community focused on personal development for HR. Gain access to our elite community, training, coaching, and events. Learn more at upskillhr.com.
Talk to us a little bit about artificial intelligence when it comes to healthcare education for employees. How does this work, and how does it help HR?
Yeah, it goes back to being at the right place at the right time. The key with good education is that it's relevant and timely. HR is never going to be with the employee at the doctor's office. They're never going to be in the employee's house as they're diagnosing themselves through Google. They're probably not going to be the ones who they get called, when their kid is sick at 3 a.m. And they probably are not sending a bunch of specialized messages based on who has what disease. And so, our virtual assistant can, and AI can. And so it's about synthesizing those different experiences along with the benefits to make that ultimate experience, HR really wants for the employees. And the result of that experience is, ultimately less questions for HR, ideally lower healthcare costs because they got the advice and the recommendations at the right time, and overall happier employees, higher employee satisfaction with their benefits.
So an employee would use HealthJoy to maybe ask if telehealth is on the plan?
So that would be the easy case, right? I think where we see the potential is, you're coming in and asking Joy to go to an urgent care facility at 3 a.m. You probably don't know you have telemedicine. In fact, 90+% of the time that's the case. You forgot that you have telemedicine. And so really it's not about the benefit, but it's the outcome that you want. You want to get your child better. And you're not going to remember your slew of 20 different websites that you had in your app, but you do know you want to go get urgent care for your child. And so at that point in time, and that's what I mean really at the right place at the right time, is that you think you want to go someplace and you can, but guess what? We can ultimately bring to the surface something like telemedicine right at that moment when you're making a decision about the care that you need. And you can kind of extend that out across, chronic care, different life events, et cetera. And so it's tough, right? Because it's very rare that someone's coming in, oh, do I have telemedicine? They're coming in and saying, I have a problem and I want to be better, or I want my spouse or dependent to be better.
Can it tell me my group number for my health insurance?
It can, yes.
Oh, awesome. Because that's the other question HR always gets, right? Like, what's my group number? I don't know what that is.
Yes, when we digitize and we bring everything into the wallet, we have the member ID and all the associated information about the particulars for that employee's insurance. So group number, RX, PCN, MIN codes, member IDs, et cetera.
AI helps the Joy, your virtual assistant. Employees can ask questions while they're in the moment, what they need to do, where they need to go. What other ways does it help beyond this kind of area, maybe in the health and wellness space that we haven't talked about?
Yeah, I think, there's several buckets. The largest bucket that I get most excited about, and where I think most excited about for a roadmap in the future, is around preventive care. And, I think that the examples of preventive care, flu shots, annual health checkups, your semi-annual dentist cleaning. We have a product called Health Opportunities that sits on top of the claims. So it basically sits on top of the employee's medical claims, and based upon the demographic of the member and where they are in their claims, sends out very personalized messaging around gaps in care. So, for instance, if you reach a certain age and you haven't had a colonoscopy, or if you haven't had a mammogram, or if you haven't had a cervical cancer screening recently. And so we're able to really have very personalized messaging at scale that you can't do with humans, which is very exciting, and where we have a lot of plans in the future around that. Second kind of buckets around wellness reminders. And so, our kind of goal during the implementation process is to align Joy with the communication plan that HR already had in store for the year. As we work with larger companies, sometimes, they actually have kind of a calendar already laid out, and they already have some wellness goals that they've already put together. So it's either could be lunch and learns, it could be, nurse on sites, could be flu shots, being administered on site. It could be, something around biometric screening, could be steps, could be a run, et cetera. And so we get to align really closely with HR and give them a whole new modality to engage, where, normally, they're doing this through email, in some cases text, of course, other cases Slack, et cetera. So it gives them really a whole new channel to communicate, which is really interesting for those wellness reminders. And then kind of the last bucket is really just benefit reminders about, the ones that are forgotten. So if you haven't funded your HSA recently, if you have an HSA and you have medical expenses that come with your claims, which we didn't notice a change in your HSA balance. If you have a deductible changes based on biometric screenings or other elements of your benefit plan, then we can do those reminders. And so we were able to key in basically unlimited flexibility around different benefits that should be surfaced to the member at the right time and scheduled. But I think that kind of those are the kind of the big primary buckets.
I like this. And you mentioned Slack, like the conversations around medical questions are separate from Slack channels, email, and those other spaces that, I don't know, it just feels more, I don't know how to describe it, but yeah, personal, just better. Like, I don't have to ask my HR professional for this question. I can go to something that's a little bit more confidential, if you will, and ask for that group number, or where I need to go to be able to get this appointment, instead of bugging my HR professional.
And we thought a lot about Slack and Teams as ways to integrate with them. And we always come back to the same kind of philosophical problem that, ultimately healthcare is very personal. Even though it's administered at a group level, it really needs to have that firewall between what is available to really, to the employer, and to make sure, because ultimately we have to have, consumer trust is a cornerstone. Without consumer trust, we're not going to get someone to give us the information and data we need in order to do good for them. And so it's an important point that you really kind of need this whole new modality, a new channel to work out healthcare questions with your employees.
I just feel weird asking that stuff in Slack. So I like the separation. I think one of the questions that I have as I think about all this different AI technology and Joy as a virtual assistant, I think some of the concerns maybe that HR professionals might have is the technology making it feel less human, because after all, we are human resources. What are your thoughts on that?
Absolutely, and we see it the same exact way. Even though we do have, an AI in our company, HR is never going to be replaced by an AI. Even in the world of a more advanced AI, humans will always need to have a human interaction to solve complex human problems. I think, our goal is to augment and triage the easier stuff, 365 days for HR. For instance, previous case study, one of our consultants, trusts, we fielded about 50% of questions Joy fielded instead of HR, right? And so really our focus is to allow human resources to have more invaluable human experience with their employees rather than less. It's trying to get rid of the stuff that HR professionals don't need to do, and give them more time to focus on more of those interactions.
I love it. And I feel like once you start to think about all the conversations that you have and how Joy and a virtual AI assistant can help, it's going to make you be able to have more time to have those in person and like real conversations with your team members and your employees.
Yes.
What should we be thinking about with regards to communication and healthcare benefits as we head into annual enrollment and then into 2021?
Well, this is where you have to have the COVID plug, right? I mean, in this time, everyone's remote, right? I think the strategies that worked last year to educate and deliver benefits, and the lunch and learns, the booklets, the benefit fairs, the open enrollment meetings, it's all going to be very, very different. And, the reality is, I think we see the same thing as it pertains to mental health of employees, that employees just need more support. And how do you focus on not just, delivering the benefits through Zoom or communicating them through Zoom or email, but really on that whole entire holistic experience that you want your employees to have. And now more than ever, it's important because you lost all those touch points during the year, or many of them. And so how do you have, that a modality to really keep the focus so that ultimately the employees are going to make the right decisions with all those benefits throughout the year. And so, I think that it goes back to focus on the experience, make sure that the experience that you're trying to deliver in your benefits, you're thinking about how that person is going to get this outcome in this new, kind of remote world. And it's going to be very, very difficult for a lot of companies. And it's going to be very difficult without technology to do it, because ultimately now the only way that people are communicating in offices is through technology, it's through Slack and Zoom. And I think that it's unfortunate, but it's time now that you have a new digital modality to communicate those benefits, because otherwise it's going to be very difficult to use, pen and paper again in order to have that same experience.
It's hard to go back to those lunch and learns in the break room.
Yep.
We talked a little bit about telehealth and telemedicine. It's been slowly growing, but COVID has really changed that. There's a lot more focus on virtual doctor visits and screenings. How else do you see the pandemic changing how we look at healthcare moving forward?
Yeah, telemedicine will be the front door, right? I think that incredible to see how that has become not an afterthought, but the first way that people enter into the healthcare system at this point. It's a cornerstone of our experience. And no one really wants to go into an urgent care or emergency room unless they really, really have to at this point. And when I think about that, what is telehealth? It's really about accessibility. And I think we'll see a new change in benefit design where accessibility itself is very, very much more prominent. I think the idea of telehealth and telemedicine being hidden inside of a carrier website or as an afterthought in a plan is already in the distant past. I think that this is going to help primary care finally go fully virtual, which it should have been for the last 5 years. I believe that for primary care really being able to go virtual, it's going to unlock a massive amount of providers that have been no longer practicing due to commutes or family concerns, be back at facilities. I think at-home testing is going to greatly increase. I think outpatient services will also have a great increase as people are less likely to go into the systems. So I think, overall, this shift to a digital first consumption is really going to be an incredible platform for, healthcare cost reductions for, the immediate now, but also very far into the future. If we can start with technology, I think we're going to create a huge amount of cost reduction in the system. And I think that's going to be exciting for a lot of HR professionals, a lot of companies across the country as this plays out.
For many companies, communicating with a suddenly remote workforce during the pandemic has presented significant challenges. We've talked about a few of those. What should we consider about working with maybe new virtual employees as our deadline for open enrollment approaches? Any thoughts on this area?
Yeah, I mean, definitely, as I mentioned about, kind of focusing on the experience, that you need to have a digital front door for your benefits, that you can't depend upon a PDF of a grid of different programs and services with phone numbers to expect that it's actually going to get used. So you really need to think digitally first. I think that's probably the most important. And I think beyond just the aspect of open enrollment, tripling down on onboarding, making sure that you're forging those kind of early cross-functional relationships within the org. Make sure you're doing the check-ins, the 30, 60 day, 30, 60, 90. Understand, really how a person's going to be able to fit in, make sure they're getting the resources they need to be successful. But I think what it comes down to is that really digital first is vital for how you think about your strategy going into 2021.
Well, Justin, thank you so much for taking the time to chat with us today. I know benefits annual enrollment is all on our minds right now. Where can people go to learn more about you and then HealthJoy?
Yeah, so healthjoy.com is probably the best place to start. I think that obviously explore the site and obviously reach out to our team. We'd be happy to help. We're excited to have a digital front door for benefits, and we're in all 50 states, and we have customers across every single vertical, companies I didn't even know existed. And so we're excited about this year and helping out as many companies we can in this new environment.
I think the recent pandemic, along with federal governance for healthcare enrollment, has put a spotlight on how employers can handle communication, not just for annual enrollment, but also how we choose plans and providers based on flexibility and service for our workforce. Most HR leaders will agree that benefits, regulations, and FSA or HSA plans are one of the most challenging areas to simplify for our workforce. As technology like AI becomes more widely used, support in this area is more common, and employees are more comfortable using platforms that can walk them through benefit plans, employee assistance programs, and changes to open enrollment. I'm pleased to have had Justin Holland on the podcast with us today to really make sense of a really complicated process. Thank you for joining the Workology podcast, sponsored by Workology. This podcast is for the disruptive workplace leader who's tired of the status quo. This is Jessica Miller-Merrill, and until next time, you can visit Workology.com to listen to all our podcast episodes from the Workology podcast. From the Workology podcast. From the Workology podcast. From the Workology podcast.